Hello, my name is Stephanie, and today I will perform the NG tube insertion skills video. I have checked the healthcare provider's orders and indications. I've gathered a 18 French NG tube, tape, gloves, a water-soluble lubricant, tissue, a cup of water, a 60 ml syringe, a wash basin, a pH test strip, an absorbent pad, a towel, a suction apparatus with tubes and its canister. I have made sure that all of my supplies are working properly and that I also have a safety pin. I placed all of my items on a clean, dry, flat surface. I checked the provider's orders. I enter my patient's room, close the door behind me to ensure patient privacy. I will perform hand hygiene and I will apply clean gloves. Hello, Mrs. Jackson. My name is Stephanie, and I will be your nurse today. Can you please verify your first name, last name, and date of birth for me? All right, thank you so much. So I went ahead and verified my patient's identity using two patient identifiers, and I also checked the patient's wristband. So today the doctor has ordered the placement of an NG tube for suction. So it's a tube that will be placed through your nose, and it'll go directly into your stomach to collect gastric content to clear your stomach, okay? Do I have your permission to proceed? All right, thank you so much for that. So I will go ahead and raise the bed to a high Fowler's position if my patient can tolerate it. I provided patient privacy and I will provide comfort to make sure my patient is in a comfortable position before we begin. I will take the NG tube from the packaging here and I will place the tube in a basin of warm water to help you to manage the tube when inserting it. So before inserting the tube, I will assess the patient's nares. All right, Mrs. Jackson, I'm going to ask you to please hyperextend your head while I'll use a pen light to assess the intact of tissues. I will check for irritation, abrasion, swelling, redness. I'm examining the nares for obstruction and deformities as well. Everything looks fine. All right, Mrs. Jackson, can you please breathe through one nostril while covering the other? All right, thank you so much. So if you can please do that with the other nostril. All right, everything looks good. So I will go ahead and select the nostril that has the greatest airflow, which in this case is the right one. So I will get our tube from the warm water here. I will measure how far to insert the tube by using my finger here to mark off the distance from the tip of the nose to the tip of the earlobe here, and then the tip of the earlobe here to the tip of the xiphoid process here. So for my patient, it'll be 50 centimeters. I will mark that with a piece of tape. So I will go ahead and place an absorbent pad across my patient's chest. I will go ahead and lubricate the tip of the tube with a water-soluble lubricant here. And this should help ease the insertion into the nose. I will insert the tube with its natural curve inside of my patient's nostril here. All right, Mrs. Jackson, can you please hyperextend your neck for me? Thank you so much for that. So I will gently advance the tube towards the patient's nasal pharynx. I will direct the tube along the nostril here towards the ear. If my tube is met with resistance, I want to note that I'm going to withdraw the tube and relubricate it and reinsert it into the other nostril. So once the tube has reached the oropharynx here, the patient may felt the tube in the throat, and the patient may have possibly gagged, so I want to check to see that my patient is okay. All right, Mrs. Jackson, can you tilt your head forward? And I'm going to ask you to drink and swallow some water. All right, if the patient gagged, I'm going to stop passing the tube for a few seconds. And I will also have my patient rest, take a few breaths, and take a few sips of water to calm the gag reflex. So I will pass the tube 5 to 10 centimeters with each swallow until the indicated length of the tube here has been inserted. Then I will check for a correct placement of the tube, and I will use the facilities policy. So I will go ahead and aspirate 5 to 10 mLs of gastric contact. Right. So I will use the pH strip to assess the pH, and I will want to see a 1 to 5 pH, so that will indicate that the tube is in the stomach. If the tube is not in place, I will start all over. So I will secure the tube by taping it to the bridge of the nose here, to the patient's bridge of the nose, and I will secure the tubing to the patient's gown here using the safety pin. So I will review that the tubing is in the patient's stomach by reviewing the results of a chest x-ray. So once everything's confirmed, I will attach the tube to the suction or the feeding as prescribed by the doctor. And I also want to make sure that the NG tube and the suction tube stay unclamped. I want to make a note of that. And if the suction was applied, I want to make sure that the NG patency is okay and that the suction tubing is maintained as well. I will keep accurate records of amount and the characteristics of the gastric drainage here. Once I'm finished with this step, I'm going to go ahead and discard my supply and gloves. I will perform hand hygiene. All right, Mrs. Jackson, is everything okay with you? Is there anything else I can do for you? Okay, so I'll place the call light next to you. If you do need anything, go ahead and let me know. I will document my procedure. I will document the care that I provided, the assessment findings, and my patient's response into my patient's record.